West Vancouver, Capilano.
Mr. Speaker, thank you for the opportunity to rise in the House today and speak to the critical need to do more and do better to address the opioid crisis. The issue of opioid addiction today continues to spiral out of control. How much money this government has spent is irrelevant if it hasn't made the proper changes. Now, addiction doesn't discriminate. It doesn't care about age or socioeconomic circumstance, and it doesn't care about politics and party lines. Government needs to commit to solutions that are above and beyond politics. Each day, mothers, fathers, sisters, brothers, young people and old are dying in this province, and it cannot continue to happen. Each party in this House agrees, I'm sure, that working together is the best way forward, and yet that hasn't happened. Now, people who use drugs are suffering from not only addiction, but discrimination and structural stigma. They're often mistakenly projected with negative images, but in reality, many may lead normal lives by most measures. They come from all walks of life, and the opioid crisis is having a devastating impact, not just on families, individuals, but communities across British Columbia. And one of the reasons I believe that not enough has been done to address the opioid crisis is the stigma surrounding people who are challenged with addiction. Now, addiction is not a choice. Overcoming addiction takes more than simple determination. Addiction is a complex disease of the brain and body. Stereotypes get in the way, particularly among marginalized populations, to seeking help and treatment. Stereotypes dehumanize people. Assumptions and judgments are made, and so a person may avoid getting help because of this. Because they're afraid of that judgment, they may choose to use drugs alone, further escalating the crisis. People who experience a mental illness are far more likely than others to also experience a substance abuse problem. And similarly, people who experience alcohol and drug use are much more likely to be diagnosed with a mental illness. This has escalated to such a crisis that we are constantly in reaction mode, and we've lost the focus on the ability to put in preventative supports, such as affordable and accessible access to counseling and mental health supports. Taking mental health seriously and providing affordable and accessible counseling to British Columbians, and accessible means real time, it doesn't mean a 6-month waiting list. This will help break the cycle of addiction and escalating mental health issues. Now, not always, but sometimes, and isn't sometimes better than what we've got today. And there's a great economic divide between divide for treatment and support, Mr. Speaker. There are counselors and recovery programs that have a cost associated with them, as they should. But if you are unable to pay, if you have not extended medical, you don't have a choice of getting that support. And what about the rest of us? What about the victims of trauma? Those who are unable to work, are precariously housed, are youth aging out of care? What access do they have to preventative mental health and addiction support? When someone chooses to seek help, whether it's for depression or addiction, they need to have access to low-cost counseling professionals right away. Someone cannot pause their crisis to go on a wait list. And another person's moment of clarity for seeking addiction supports may be fleeting, and the chance to help will have passed if there's a waiting list. The counselors that I know who provide subsidized counseling say that a 3-month wait list is the same as no service at all. In my previous work, I saw many gaps in supports provided to those detoxing. Most detox programs, for example, have a short time limit as to how long a person can remain. And it can be as short as 7 days where they cycle back out, they don't have supportive housing and continued supports, and they go right back into detox. This is a crisis that is not slowing down, Mr. Speaker, anytime soon, and it will take everyone to address it. It takes compassion and understanding. Let's help people feel empowered, not filled with shame. There's no overnight solution, but there are solutions. This needs commitment and more investment in preventative supports, Mr. Speaker. Noting the hour, Mr. Speaker, I move adjournment of the debate.